Well, thank you for that segment, and thank you for supporting today's program as well. My next guest has been working hard to promote the safety of the COVID-19 vaccine to overcome what's out there as a real thing, community skepticism. She's the first nurse to be elected to Congress, the first woman to chair the House Committee on Science, Space, and Technology. I loved my conversation with her a couple of months ago on science and the science ecosystem and what we needed to do. Welcome, Congresswoman Bernice Johnson. It's great to see you again, Congresswoman. I want to just say today we're talking about the challenge of our time, COVID-19, how we get the vaccine right, how we deal with manufacturing and other elements like PPE, how we get the last mile. I mean, it's many different dimensions. And I know that as you have looked about this, you said what really matters in the end is are we helping people together? What is missing right now as you look at this ecosystem of response to COVID-19?
Well, I hope we're beginning to look at more coordination. Under the past administration, it was disjointed, and it had the appearance of being very partisan in the way the materials were distributed, the way the vaccine was distributed, the lack of information. So we're still trying to get past that. In my local area, we had lots of skepticism about whether to take the vaccine. But now that we've convinced a lot of people of how helpful it'll be, we're having difficulty getting a supply. And where the supply will be, we're in the process of working that out. This really is not an issue that should be tainted with politics. It's pure science, in my judgment, and pure healthcare. And we've got lots of information as to where the greatest deficits are, the most vulnerable populations, and all of that. All we need now is some strong leadership to make sure we get the information and that supply out to the people, hopefully all of the people, but trying our best to do something about the most vulnerable as quickly as we can. And we've tried that with healthcare professionals, with people that are on the front line. We've got to deal with the entire population, however, and I hope we're on our way to it now.
Well, I mean, it sounds promising the way you describe it, and we have a very full program today. But as I just discussed with Dr. Fauci, you know, if you kind of look at the fact that we're no longer storing vaccines, as soon as they come in the door, they're out, right? It's based on just in time, and you've got to trust that the supply is somehow going to meet responsible distribution. I think the same thing in PPE. We have an ongoing major national health crisis. We have a lot. We're going to talk to some folks from 3M in a moment that are producing masks. But when you kind of look at out there, you've got places that don't trust the system. They're stockpiling those, certain states, certain hospital systems, because they're afraid of not having it. What do you think we need to do by way of communications or whatever to move from being fearful that we're not going to get what we have to trusting that we're going to have what we need?
Well, we are a nation of competition, and I don't think we're going to get rid of that. But we really do need to be guided by scientific determinations and where the supply is most needed. I think we are moving in that direction. The president has indicated that we will get more supply. That will help a great deal, because when politics enter, and it's hard to have a life in the United States without politics, we tend to put personal attitudes above actual need. Hopefully, we can get beyond that very quickly. We're working on that locally where I am, where the distribution has been very skewed. But we really needed to get to every part of the population. I think that's the only way we're going to really put a curve on this pandemic. We started out behind the ball. We've got to catch up. So which means we got to correct some of the problems that we dealt with in the early part of recognizing that we had a pandemic on our hand.
I don't know if you heard my conversation with Dr. Francis Collins a few minutes ago, but I asked him, I said, look, you were director of the Human Genome Project. That was required major investment. If you had more money and resources today, would you be able to deliver more scientific returns, scientifically based and grounded returns to America? And he said, absolutely. We leave a lot of science on the table. You and I talked last time about Dr. Franz Cordova, the National Science Foundation, NASA. These are all part of your committee. Have we been underinvesting in science?
Yes, we have. Not only have we underinvested to a large degree, we've also had so much politics to interfere with it. Hopefully, we're getting away from that with the new administration, because science is really not political. Pure science, it should be available to everyone in the world for sharing. We often have to share cost, but it's not supposed to be tainted with politics. When we have scientific endeavors that we must invest in, it must be continuous. It can't be jerked by one administration and put back by the other. Research is always on the front burner. It should be, so that we can have good, sound results, so we'll know where we're going. That's the only way we save money and reach the goals that we have set. I think we should have a continuous stream of investment in research. And that's been my story since we started talking about this pandemic, that we had to deal with the virus, not just the effects of the virus. And so we've continued to push for that. We feel very optimistic about our future, but it's not just this pandemic. Periodically, we have others. We got to stay ahead of the curve. We see getting into this late what it has done for us. We have one of the worst economies. We have the nation with many of the most people that have come in contact with the virus could have been prevented. And hopefully we see that now. And going forward, we can make those investments because we have several things hitting us at one time. First, we have not addressed the environment as we should, which makes a pandemic even more common because our seasons are not as distinct. And when we have all this warming of the climates, the bacteria will stay in the atmosphere and move around the globe. We have to recognize all of those points and stay on top of our research. We might not see the return on that research as we would when we invest in a farm, but we see the return when we face it and take it ahead of time. We saw the effects of the return when SARS broke out. It didn't hit this country like it did others. If we had been ahead of that, as we could have been with this, we would not be suffering nearly as much.
Well, thank you. Well, Congresswoman, we've been taking questions from our audience, and we've got a question from you from Kramer. Kramer
Phillips with KPR Media. My question is, legislatively, is there anything Congress can do in coordination with private companies to speed up distribution of the vaccine? And is there a role for the U.S. military in terms of distribution of the vaccine? Thank you.
Thank you. Congresswoman?
Well, thank you. We can write legislation that permits all that, but how it's done will be with the executive branch. It will rest with the military, it will rest with other arrangements they have with the private sector. The private sector has developed most of these vaccines now, and as long as we can get it and get it distributed in the right places, that is the function of the executive branch. But it is a responsibility of the legislative branch to make sure that we put in place and fund the research to make sure that the supply is there, and leave it to the executive branch to implement the legislation.
Well, Congresswoman Bernice Johnson, I really appreciate your time, and I particularly wanted to zero in on what you said. You know, we've been sort of reacting to COVID right now. The question is, how do you get strategic in preparing, for the next challenges to the country? You and I had that conversation a couple of months ago, and very, very grateful for your time and thoughts today. Thanks so much for joining us.
Well, thank you very much. I appreciate the invitation.
That brings us to the end of part one of this summit. But don't go far. Get some coffee, a snack. I'm going to. And we're going to be back in just 5 minutes.